Hello guys, I'm Sound from Inspiring Minds, and today we will discuss about the adrenergic antagonists. What do you mean by antagonist? As in my previous videos I have told you, antagonist means any antagonist agent means that it binds to the receptor and blocks the intrinsic activity of the receptor. Adrenergic antagonist means that it will block the sympathetic outflow, that it will block the action of epinephrine and the norepinephrine that usually occurs by the sympathetic stimulation. Yes, so we know that we have different type of adrenergic receptor: alpha 1, alpha 2, beta 1 and beta 2. So today we are going to discuss about the alpha antagonist, or the drugs which will block the alpha receptors and the effect of norepinephrine that occurs in the alpha receptors. Okay, so we have classified them into selective and the non-selective. Let's talk about the non-selective. Non-selective ka mean hai, the meaning of the non-selective is the agent or the drug is blocking both alpha receptors, that it is blocking alpha 1 also and it is blocking alpha 2 also. And the name of the drug is, first we'll remember the name of the drug, then we'll come to the action, because name we usually, what happen, we usually forget the name and we remember the action. So the name should be remembered first with the classification. Okay, the alpha 1 and the alpha 2 antagonist, non-selective antagonist means phenoxybenzenamine. So first drug, it's starting with the P. Both of them are starting with the P. First is phenoxybenzenamine and the second is phentolamine. So these two are non-selective alpha antagonist. Then we'll come to the selective alpha antagonist. Selective means it is blocking only one type of receptor, that either alpha 1 or alpha 2. So if it blocks alpha 1 receptor, it is selective alpha 1 antagonist. Okay, example, these drugs, that is selective alpha 1 antagonist, they usually have committed a lot of sins in their life. Okay, so we are ending them with the O sin, O sin, O sin, O sin. Okay, so example, prazosin, doxazosin, alfuzosin. Then we have the tamsulosin. Tamsulosin, I will like you to remember that the tamsulosin is alpha 1 antagonist, but it is even more selective. It is blocking one special type of alpha 1 receptor. Which special type of alpha 1 receptor is it? Alpha 1a. This alpha 1a receptor is present in your, what we say, prostate. Yes, prostate. So it causes the relaxation and it's used in the treatment of benign prostatic hyperplasia. I'll talk about it later, but this you should remember that in alpha 1 antagonist also, the tamsulosin is more selective to alpha 1a, and this prazosin, doxazosin, alfuzosin is more selective to alpha 1b. Okay, then we have the selective alpha 2 agonist, which is called as yohimbine. Okay, now let us talk about the clinical or the use of these alpha 2 antagonists or alpha 1 antagonist. First let us study about the non-selective one. Non-selective, the most famous example I've given you is what? Phenoxybenzenamine. So remember that alpha 1 receptors are mainly present in the blood vessels. For example, this is the blood vessel and peripheral blood vessel in your body, and in all the most of the peripheral blood vessel of your body, we have which type of receptor? Alpha 1. So this is alpha 1 receptor. Normally what is happening without any use of this drug, normally physiologically what is happening is that a sympathetic nerve ending is there. This is what? Sympathetic neuron, postganglionic, and this is secreting norepinephrine on this alpha 1 receptor. So because it is secreting norepinephrine on this alpha 1 receptor, what is physiologically occurring is that these vessels are in the state of constriction. Because these vessels are in state of constriction, they have maintained some amount of vasoconstriction, and thus they have maintained the blood pressure in your body, especially the diastolic blood pressure. Because for maintaining the blood pressure in your body, what should be there? You should constrict the vessels. Yes, because more the constriction is there, the blood vessel is constantly maintained in your body, the diastolic pressure that is in your blood vessels, peripheral blood vessels. So Normally this happens that these vessels are in the state of constriction. Why? Because norepinephrine is being secreted on the alpha 1 receptors that are present mainly in your peripheral blood vessels. So alpha 1 blocking agent, how do they act? Alpha 1 blocking agent जो है, it will act and block this receptor, and by blocking this receptor obviously the norepinephrine will not be able to act on alpha 1 receptor, and what will happen, this vessel that was there in constricted state, it will become dilated. So this is the dilated vessels, you see, and in the dilated vessel you have increased the volume of the vessel. So what will happen to the pressure? We know the reverse relationship between the pressure and the volume. The volume of the vessel has increased, the pressure in it will rapidly fall down. Okay, so this is how the alpha 1 antagonists are used. They can rapidly lower your blood pressure. Yeah, so the first use of alpha 1 antagonist is what? They affect the BP, blood pressure. By what? They cause the peripheral vasodilation, and obviously vasodilation is caused in the peripheral blood vessel. So is there any resistance to the blood flow? The heart has to do less work because the pressure in the vessel is less, so heart can pump the blood easily. So it has caused the reduced peripheral resistance. So reduced total peripheral resistance, and because of reduced total peripheral resistance, because that is due to the vasodilation, the heart is able to pump the blood more effectively. Yes, and the blood pressure in the patient reduces. So this is one application of alpha 1 blockers. Okay, so phenoxybenzene, because it is alpha 1 blocker also, so it will produce what? A rapid fall in the blood pressure. Yes, so fall in the blood pressure will be there. And what happens is that we have dilated the peripheral blood vessel, the blood pressure in all your peripheral blood vessel has rapidly decreased, and we know we have the baroreceptors here in your neck region, carotid sinuses, we know, and because the baroreceptor senses that why there is a rapid fall in the blood pressure in your blood vessel, so what will it cause? It will cause increased sympathetic activity on your heart, and heart will rapidly start pumping blood. The heart rate will increase. This is called the reflex tachycardia. Why reflex tachycardia? Because you had the sudden drop in your peripheral blood pressure, and it stimulated the baroreceptor in your carotid sinuses, and from there the signal went to the heart to increase the pumping and to increase the heart rate. So that is called as reflex tachycardia. So mostly all the alpha 1 blockers, they produces the reflex tachycardia. Okay, reflex tachycardia because it is a reflex arc what we have formed. So let us now mainly concentrate on the phenoxybenzene. Phenoxybenzene is such a drug that it blocks the alpha 1 and the alpha 2 receptor for irreversibly, and this irreversible blocking means that all the effect of norepinephrine and the epinephrine also on your alpha 1 receptor is reduced drastically because of irreversible blockage, and this blockage can occur for 24 hours. So why it is irreversible if I'm saying the blockage is for 24 hours? Because the new alpha receptors will be synthesized by the body, and on the new alpha receptors we don't have the phenoxybenzene acting. So the receptors that are blocked, that alpha 1 receptor that are blocked or alpha 2 that are blocked, they are blocked for irreversible time. Okay, and till the time the receptors get destroyed. When the body synthesizes new alpha receptors, then only the effect of phenoxybenzene will be reversed. Okay, so the effect of phenoxybenzene is usually for 24 hours of action. So it is a great thing in certain circumstances. For example, in your emergency department, a patient comes and you don't know much about that patient, but you check the blood pressure and the blood pressure of the patient is excessively high. So what you can do, the phenoxybenzene can be used. It will rapidly lower the blood pressure and decrease the total peripheral resistance, and but it have a capacity to cause reflex tachycardia. But yes, the usefulness is more than the reflex tachycardia. It may not occur in all the cases. Okay, then this is the alpha 1 mediated effect of phenoxybenzene. Now we come to the alpha 2 mediated effect. Okay, for example, this is heart. I am drawing a heart. We know what type of receptors are present on heart. This is heart. Yes, this black one, and this heart has beta 1 receptors. Yes, and the adrenergic nerve ending we have. On the adrenergic nerve ending, if you remember, on the adrenergic nerve ending, post synaptically, we have alpha 2 type of receptor. Yes, alpha 2 type of receptors. Normally, what happened when any antagonist, alpha 2 antagonist, binds to adrenergic nerve ending, it causes what? Less secretion or reduced secretion of norepinephrine into the synaptic cleft. This is what happens physiologically if this alpha 2 receptor is normally functioning, or alpha 1 agonist is acting on the receptor. Okay, now what we have done, we have phenoxybenzenamine that can block the alpha 2 receptor. If the alpha 2 receptor is blocked on adrenergic nerve ending, what will happen? There will be no inhibition to release of norepinephrine into the synaptic cleft and the effector organs. Yes, so norepinephrine will be released from the adrenergic nerve ending in high amounts to bind with the beta 1 adrenergic receptors that are present on heart. Why it has increased? Why the norepinephrine has increased? Because we have blocked the alpha 2 receptor because of action of phenoxybenzenamine. Okay, so because of alpha 2 mediated blockage, alpha 2 blockage of phenoxybenzenamine, there is increased norepinephrine acting on the beta 1 receptors on the heart, and again side effects come. What side effect? Tachycardia. So this drug, because of indirect action on beta 1 receptor on the heart, this can cause tachycardia, and the cardiac arrhythmias can be precipitated. So what we see, it has a lot of side effects also. So that is why, because of potential side effects this phenoxybenzenamine has, it is not very much used nowadays. Thus it is just used for the treatment of the chronic pheochromocytoma. What is chronic pheochromocytoma? It is nothing but the adrenergic tumor. Yes, the tumor of the adrenal glands, and which results into increased norepinephrine in your body. That will result into increased blood pressure, tachycardia, and all the sympathetic symptoms what we have. So as we know, this alpha 1 effect of the benzenamine is for 24 hours, so it can block the alpha 1 receptor for 24 hours, and therefore just by taking one tablet of phenoxybenzenamine, you will have reduced sympathetic activity throughout your day. So this can be used in the treatment of the chronic pheochromocytoma. Then the most famous action of, or the use of phenoxybenzenamine, is epinephrine reversal. Epinephrine reversal. For example, a patient came to you, he was or she was in the state of shock, and you gave him epinephrine. Okay, but by mistake you have given a lot of dose of epinephrine to your patient, and what has happened now is that there is severe vasoconstriction of the patient's peripheral blood vessels because of action of alpha 1 action of epinephrine on the blood vessel. So by giving the phenoxybenzenamine, that is alpha 1 antagonist, you can prevent the action of epinephrine on the peripheral blood vessels. Thus, if the blood pressure has been, a lot of increase of blood pressure occurs because of epinephrine, so by administering that patient phenoxybenzenamine, you can reduce the effect of epinephrine, and phenoxybenzenamine, because of alpha 1 antagonistic activity, will cause rapid decrease in the blood pressure of the patient. So it is one of the use, that is epinephrine reversal. Okay, then we have other type of alpha 1 antagonist drugs that I told you earlier. We have the prazosin, trazodone, doxazosine. Okay, so remember, prazosin, trazodone, doxazosine. Doxazosine is the longest acting. That is why I have drawn big D, because it has the longest duration of action. Where can be it used? Obviously in the management of the hypertensive patient, because of alpha 1 adrenergic blocking activity. Then out of them, you should remember alpha 1 antagonist that is called as tamsulosin, that is more what we say alpha 1a antagonist, and this is used in the treatment of benign prostatic hyperplasia. In old age, what happens, the prostate gland enlarges and it blocks the urinary output. Okay, so the alpha 1 receptor that is present on the prostatic glands, the drug bind to the prostate gland and it causes the relaxation of the prostate gland, and then the urinary output can be maintained, that is usually blocked in the benign prostatic hyperplasia. So tamsulosin, always remember tamsulosin for benign prostatic hyperplasia. Remember the receptor also, alpha 1a type of receptor. Okay, then what we have, okay, can you now just tell me the side effects of alpha 1 blockers? Obviously, by blocking the alpha 1 receptor in your peripheral blood vessel, it can cause what? Orthostatic hypotension. Orthostatic hypotension, because there is rapid what increase in the volume of your peripheral blood vessel and rapid reduction in your blood pressure in all your peripheral blood vessels. So what will it result into? Orthostatic hypotension. Orthostatic hypotension means that you are lying down on the bed, you were sleeping and you just stood up and rapidly a syncope occurs and you faint. Standing from your bed, you are fainting. Why? Because you were taking alpha 1 blockers such as prazosin. Yes, so the patient fainted. Why? Because when you woke up, rapidly your blood pressure decreased and your body didn't have, because blood pressure is already decreased because of the action of alpha 1 blocking action, and as soon as you woke up from your bed, there is pooling of your blood from your brain to peripheral part of your body because of gravity as you wake up from the bed. So already the peripheral blood pressure was lower, and as you woke up, there is gravity pulling your blood down, and there is a loss of what we say, a temporary loss of your blood flow into your brain, and that causes fainting in the patient. That is called as orthostatic hypotension. So that is one of the side effects of these alpha blockers. So remember that whenever you are giving a patient alpha blockers, first of all start with a very low dose so that you can see your patient is okay with it or no. If you are giving a very high dose, okay, patient took it, he slept at the night, woke up and he got fainted and maybe his head got hit on some object, so it is very it can be lethal also. So remember the main side effect, that is orthostatic hypotension. Mainly other, because of orthostatic hypotension, there is what lack of energy. Patient will be always complaining you about lack of energy, not willing to do any work, tiredness. So that is also due to all peripheral effects that it has. Okay, then we have the alpha 2 blocker. Remember, yohimbine is the name. Alpha 2 blocker. This alpha 2 blocker mainly act on the central nervous system. It doesn't have many uses as for now, but it is used for the treatment of erectile dysfunction and the sexual dysfunction. Just remember it, that is enough for solving the questions. Okay, thank you everybody for listening to the videos. Keep subscribing and liking the channel for further videos. Thank you very much.